few follow-up questions. So, on the global data sharing, there's been some challenges of counties cooperating and participating within that. So,
I don't know that I would characterize it as counties cooperating.
You have four that are participating with the state. So when you have 58 counties, I mean, I think there's been some challenges, or 56 actually systems. But so I think there's, how would you characterize
I would characterize those 4 counties as the early adopters. The Global Data Sharing Agreement is a relatively recent phenomenon. And as a county supervisor, you had county council. And imagine 58 county council looking at a 150-page legal agreement that deals with any number of state and federal laws that address confidentiality and liability for violating those laws. I think the state did a great thing. I think DSS and DHCS did a great thing. They got a head start. They came up with a model agreement. Mm-hmm. Now counties, to enter into it, go to their boards. The boards ask for county council. And you can imagine that that's a process that we're working through. I'm here to tell you that from my association standpoint, it is our hope that every county signs a global data sharing agreement. Every county is going to have to enter into some kind of agreement with the state in order to implement SB 238, which we're sponsoring, co-sponsoring. And so that is a way of saying we are absolutely committed to doing whatever we can as an association to get our members and the state on the same page with the global data sharing agreement, so every county in the state has the ability to receive that information to better monitor and oversee the kids in their care. And we have every expectation that SB 238 will be passed and signed, and so we think it's going to happen one way or another fairly soon.
All right, so next year, what I just heard is Mr. Mecca is delivering. So we're back here doing a follow-up hearing, and so we'll talk about it again.
We will.
And hopefully we'll have more than the soon-to-be 5 early adopters.
We hope that we will be able to have some early information about how SB 238 is working on the ground.
Just
Governor.
Not to be crunchy.
I like it. Talk about the increase, and would like to be able to go back to a question that I asked Ms. Ryan, and that is why the significant increase in psych meds over the last decade?
I have a this is a hypothesis.
Yeah, you're editorial.
I think in one way, it's an evidence of something good, and Ms. Johnson-Vaughn talked about the reduction in the overall number of kids in the foster care system, and I think the kids that are no longer in our system suffered less trauma. I think the kids that are in our system now have suffered more, and so I think it's just a more traumatized group. And I think it's not great that they've experienced the trauma, but the fact that proportionately they have a greater set of mental health needs, I think is part of the story. I do think it's hard to listen to providers and others and not come to the conclusion that Mr. Schroeder came to, which resonates with us, and that is it's the easiest to obtain and the most available to obtain mental health treatment. Mm-hmm. And access to non-pharmacological, highly effective, trauma-informed treatments, we're all working hard to get those online, but I don't think they're as available. And I do think Mr. Schroeder's sort of point that you take what you have when you have a mental health emergency in front of you. That resonates with me. I can't prove it, but I think that has to be at least one of the factors.
No, and I hear that. I think that, and just my own editorial is, the pill doesn't treat trauma, right? Mm-hmm. So to be able to actually go towards the trauma, we need to be able to look at where you started your testimony today, providing the robust trauma therapy and ongoing mental health service to that youth. And candidly, and I am not a medical professional, but it seems like a quicker, cheaper form to go after versus providing that robust mental health service at the group home level. But, Ms. Ryan.
I'm just thinking about this while I'm sitting here.
Yeah.
So our non-specialty mental health system, our specialty mental health system is community-based. It's a rehab option. We can serve you in your home or wherever you happen to be. The clinic option, which the managed care plans operate under, you have to go to the doctor's office. Most people in general, not talking about Medi-Cal, but most people in general get their psychiatric medications from their primary care physician. That's the easiest thing they do. They're not very good at offering therapy. They don't go out to your house. So it's a hypothesis that ought to be explored. Now these people have, we're not talking about the foster, they always had coverage. So I just think that they have coverage for mild to moderate where they didn't really have access to that before. And if a pediatrician can prescribe a medication for a child, that's the easiest. It is really the easiest way to address an issue if you don't have access to the specialty mental health system, or you don't have an array of services that you're allowed to provide that are part of your system. So I think that's something we should all look at.
Yeah, and I think, frankly, I think group homes share this responsibility as well, right? So this is not just pointing to whether it's just counties. I think we also have those group homes that are working with counties. And when you have one contracted physician that may be overseeing multiple group homes that needs to see multiple foster youth on a daily basis, it's the quickest and cheapest. So, and I think that's the piece. And what Ms. Ryan just said is we need more oversight. And to be able to get more oversight, we need to be able to track, we need to be able to monitor, we have to have the data. And that just seems like one of the most significant gaps that we have is getting down to the data to ensure that we are providing the most effective service as well. Yeah, please.
If I make one comment, and this is not a shameless plug for 238, SB 238.
I haven't heard you talk about that yet.
But whether it's done in the context of 238 or it's done voluntarily by the Administrative Office of the Courts, it is interesting that we as a state have vested sort of the ultimate authority over approving a psychotropic medication to the judge, who hasn't not been here today. And when they say, look, we know what people tell us, but we're not medical experts ourselves, and so we get the JV 220, it doesn't always give us a whole lot of information. And representing people who routinely go before judges and are held accountable to judges on a daily basis in the child welfare system, I think when presented with a more robust amount of information about a youth's experience at the time that perhaps they're being asked to approve a psychotropic medication, I think it really does change things. Because when the judge asks, well, what happened in the prior county? What non-pharmacological alternatives have been tried? If none, why not? What other drugs have been tried? It's the array of questions that I think they would like to ask. I think they're questions to which we would like to have answers, but that data sharing is critical, and being able to have the data and present it before judges who get to tell us what to do and what not to do, I really do think has the opportunity for systemic improvement.
No, I appreciate that. Thank you so much. I want to say thank you to our panel and do look forward to working with the department here as we move forward. We do have, we're going to open it up for public comment, but I appreciate the questions, the willingness to have the conversation today. And we are going to be following up with our third hearing either at the end, at the end of this calendar year. So we'll be working with department on an update as well, as we want to continue to push forward. And again, I just want to say thank you so much for your work today. We do have an opportunity to hear from all of you, and again, I appreciate everyone's patience sitting here today. I hope folks are gathering up the chocolate, which is in the back of the room. And if not, please start passing it around, as that is one of our traditions here at our Human Services Committee. We have a microphone ready for you. Would like to be able to invite you up to be able to say your piece today. We are going to keep it to 3 minutes per individual, and we welcome you to please come and please state your first and last name. Anyone want to be able to testify here today under public comment? Mr. Gardner, are you heading up? All right. There we go.
Do first.
Yeah, absolutely.
Yeah, so I just wanted to, there was so much commentary, it's hard to not want to respond to a great deal of it, but I just wanted to say one thing, and that is, you know, when we do have data, it's also, of course, incumbent upon us to look at the data and actually use it. And we had this conversation up here about whether or not there are waiting lists, whether or not there is challenges to access. And the response is, well, we don't hear about it, or when we do, we try and pin it down. But the thing that you have to understand is when somebody asks somebody in the system, is there a waiting list, that's tantamount to asking them, do you admit that you're in violation of state or federal law? So you're almost never going to get anyone to say, yeah, we have waiting lists, right? So it really doesn't necessarily get us to where we want to go. But let me just point out, in the charts that I was showing you earlier, there was this mental health services penetration rates comparison over 10 years. If you want to know whether we have waiting lists or whether we have access problems, all you have to do is look at the chart and see that in Fresno County, their penetration rate is 3.59%. And in San Francisco County, their penetration rate is 10.13%. If anyone seriously doubts that Fresno doesn't have a waiting list problem or an access to care problem, they're not using the data in a way that is informative. And so I really do think that sometimes we do have the data. We do have information that should tell us what's happening in our system. And if we're curious, and we are concerned about access to care, all you have to do is look at this chart and say, we have some serious issues. And then we go to the accountability part, and there's this system right now where the legislature has told the Department of Finance that it's their duty to determine how to allocate EPSTT dollars to all of the counties. Okay, so we know we have a problem in terms of access to care. And the legislature has turned over the most potent authority for accountability to the Department of Finance, who is now sitting on their hands, unable to determine how to split up the dollars between the counties. It does raise the question, isn't it perhaps more important for the legislature to get into the business of dealing with accountability and thereby allocating dollars among the counties so as to ensure that the kinds of obligations that the counties have taken on are actually met. So when these kids don't get services in Fresno County, that is a violation of federal law. And we have, what, something like $140 million in new state money coming down this year. There's $60 million from last year. That gets matched by the federal government. So we have almost $500 million in new money coming to the counties. Where's the accountability for ensuring that the kids in Fresno County actually get the services that they're entitled to? Thank you.
No, I appreciate that. And Sarah and I were just mentioning that. You're absolutely right. So thank you so much. And related to wait times, that has been an issue that we've had with individuals that have come forward, is very concerned in what those penalties would be. So thank you so much. Would anyone else like to be able to come forward and say your piece at the hearing today? Hey.
Hi again. Patrick started this, so.
No worries.
Senator Hernandez asked a question, if you could reinvent the system, what would you do? How would you do that? And I said, well, things have to be mandatory. But I also think that a discretionary fund, similar to what adults typically have with their insurance policies, is that here's a list of services you can choose from. If we're saying we're going to mandate child and family teams and that child voice is important, then maybe they should have some control over the spending in their own lives and to be able to choose, I want a music class to help me with my health and well-being. I want a gym membership. Not everything has to be a county contract, and we have funds. And so maybe that's how I'd reinvent it and give a little bit more power to the youth in their own spending.
No, thank you so much. I'm grateful, and thank you again for being here today. Anyone else? All right, we're going to be closing the public comment portion of today's hearing. Want to take a moment to say thank you so much for all of you being here today, whether you were a panelist, and by the way, former foster youth, you did fantastic today, so thank you so much. Really grateful and appreciate your courage to be able to say your story. To our first and to our second panel, we are grateful. I do want to say thank you to amazing committee consultants. Obviously, Sarah has done a tremendous job today. Also want to say thank you to Mariva as well for her continued work, and greatly appreciate it. And of course, Ray as well from Health Services. We are grateful, and we're looking forward to working with you a lot on this issue here in the months to come. And we also want to say thank you to Senator Hernandez and his incredible leadership on this issue and stepping forward. He has been an incredible advocate, and we're grateful. But Ray, it's really nice work, sir, and we're really grateful for the partnership. I just want to end it with this, a commitment that the Human Services Committee made back in February is that we are not going to let another decade go by. We had a special order hearing on the bills that are advancing in May. We are here today discussing this important issue. As we've identified the issue back in February, we're now seeking solutions. And what we're going to be doing is bringing forward another set of pieces of legislation in the upcoming year focused on fixing our broken foster youth system. In addition, we have submitted a request to the Joint Legislative Audit Committee for a state audit that will review how state and local agencies track whether children prescribed psychotropic medication received psychosocial services prior to the prescription and concurrent with medication, and ask the audit to review whether the data for accuracy and how it is used. Additionally, we have asked the auditor for information about whether there are structural deficiencies, network inadequacies, or adverse incentives in the foster care system that serve as barriers to foster youth receiving appropriate psychosocial services. This is an issue that we are focusing on. This is an issue that we are intending to push forward in the months and years to come. And it's going to take all of us working together to bring forward these desperately needed reforms. And again, not letting another decade go by. We're talking about human lives of our foster youth. This committee is adjourned, and we are grateful for your participation and your incredible collaboration. Thank you so much for being here.